this presentation, we're going to go over lower extremity bony and soft tissue landmarks. These landmarks are used every day in the O&P facility to communicate locations on the body, and also are locations that we use to measure from. So they may be a starting point or a foundation point for the measurements to be taken from. We also may have to build up plaster over these areas. You may have to relieve these areas, but anyhow, they're important to know, and that's what we're going to go over today. Now we're going to go over the long bones of the leg. It's important to know these bones and where they're positioned within the body. So we'll start from the distal end here. The tibia is the larger of the two bones in the shin here, and so the tibia is this big one over here, and then the fibula is the smaller, finer bone on the lateral side. The tibia is medial, and the fibula is lateral. The way I remember this is the tibia is Tiberius, or a big tiger, and that's a very strong name, so it's the larger bone. And then fibula is feeble, so the F stands for feeble. It's the smaller bone. The other long bone is the more proximal bone, and it's the femur. Of course, it contains the hip joint and then makes up part of the knee joint down here. And then finally, the little bone here is a sesamoid bone, and that's a bone that's embedded in tendon, and that's your patella. So the patella is another landmark that we'll use. Now we're going to go into the bones of the foot. So the first one, we'll start distally again, and the phalanges are also your toes. So all these bones down here, there are 3 phalanges, bones in each of the lesser toes. And then the great toe, which is on the medial side here, just has 2 bones in it. So 2 bones in the great toe, and then 3 bones in the lesser toes over here. The next one is the metatarsals. So as you move more proximal, then we have our 1st, 2nd, 3rd, 4th, and 5th metatarsal. The metatarsal heads we'll get into in a little bit when we start actually going over the landmarks and then also the bases. These are our cuneiform bones here. There's 3. There's the 1st, the 2nd, and the 3rd, and then sometimes they're referred to as the medial, the intermediate, and the lateral cuneiform. Then, just lateral to those, we have a larger bone here, which is a cuboid. The cuboid's kind of interesting because where every other, the cuneiforms, I should say, have 1 metatarsal that lines up with each one of the cuneiform bones, the cuboid has 2 metatarsals that it connects to. So it has to do twice the work of the other ones. And then we have the navicular. This is probably the most common bone that we have problems with when we're fitting foot orthosis. As the foot collapses and goes flat, the navicular tends to stick out farther towards the medial side, become more prominent. And when that happens, we have to do build-ups for those. So that's the navicular. It can be a troublesome bony landmark. Then behind that, we have the calcaneus. So calcaneus is here. And then on top of the calcaneus sits the talus, which is this smaller bone up on top here. Just kind of go over these from the lateral side. This would be your metatarsals over here, and these would be your phalanges out here. On the medial side, we have our phalanges, our metatarsals. This would be our 1st cuneiform, our navicular, our talus up here on top, and then the calcaneus down here on the bottom. So those are the bones of the foot. Foot's divided into 3 sections. We have a forefoot section, which contains the metatarsals and the phalanges. You also have the midfoot section, which contains all the cuneiforms and the cuboid and the navicular. So those bones are in the midfoot. And then finally the rear foot section, which is the talus and the calcaneus back here in the posterior. Now we're going to start with the bony landmarks. Since we know the bones of the foot and also the bones of the leg, we can start talking about the landmarks that are important when you're building an orthosis or a prosthesis. So now we have the bony landmarks associated with the foot. The first one we're going to start with is going to be the 1st metatarsal head. And so the 1st metatarsal head is right here. This is the medial side of the foot. You can see here's the calcaneus, we have the talus, we got the navicular, 1st cuneiform, our metatarsals, and the head is the part that actually touches the ground. So this is the head of the 1st metatarsal right here. And we use this a lot for determining trim lines and the finished anterior trim line of the orthosis. The 5th metatarsal head is going to be seen on the lateral side. So here's the calcaneus. We got the base of the 5th here, and this is the head of the 5th right here. So again, this one's going to be used for determining trim lines also. These areas also could be sensitive, especially on the lateral side. So we have to make sure we have reliefs for that area also. And then base of the fifth would be this right here. So you've got the base of the fifth right here. And the bases are always more proximal. So if you look at the metatarsals, every metatarsal has its own base. So the base of the first, base of the second, base of the third, base of the fourth. It just so happens the base of the fifth is the most prominent on the lateral side. And it's got a little kind of bone or a little nodule that kind of sticks out on the side, or a tubercle. So that's the base of the fifth. And this is an area that can cause trouble also during fitting. And then finally we have our navicular. So this is our medial view right here. And our navicular is this bone right here. It tends to stick out sometimes, especially if a patient pronates or if they have flat feet. The navicular becomes very prominent on their foot. So let's kind of go over and we'll look at the plantar. This is the plantar surface here, and this is the dorsal surface here of the foot. So this is a top view and this is a bottom view. If I look at the first metatarsal heads, it's going to be right here, the first metatarsal head. The fifth metatarsal head is going to be located right here. And then the base of the fifth is this area right here. You can see the base of the fifth on the plantar surface right here. And then finally we have the navicular on the medial side here, and the navicular on the medial side here on the plantar surface. The other things we can look at on the plantar surface, we have two bones right here, and these are called sesamoid bones. And so these are very similar to your kneecap or your patella, which is embedded in a tendon. These two little bones here, which are kind of like peas, are also embedded in a tendon in the foot. So these are your sesamoid bones. Now we're going to do the bony landmarks of the tibia and the fibula. The first ones are medial, lateral, malleolus. So a malleolus is your ankle bone, what you think of as your ankle bone. On the lateral side, it is right here, you can see it. On the medial side, it's right here. You'll notice that the medial malleolus is higher than the lateral malleolus. So the lateral malleolus is lower. The medial malleolus, however, is the one that we use to set the height of the ankle joint later on with most of our AFOs, especially if they're articulating. So this is an important landmark to know. Distal tip of medial malleolus is this one right here. Distal tip of medial malleolus. That's a very important one. Next one's going to be the tibial crest. The tibial crest is this bony part of your shin here. It's the part that you hit on the coffee table when you're walking through the living room at night. So that's your shin right there. It's called your tibial crest. And then right on top of the tibial crest, just proximal to it, is a little bony outcropping. You can see it here. And you can also see it here. There's a little bump right there. And that's called a tibial tubercle. Whenever you hear the word tubercle, if you think of a potato, potatoes are tubers. And so just think of a little potato sitting on top of the bone. So your tibial tubercle is just a small bump on a bone. So that's what this is, the tibial tubercle. We use this one a lot, again, for measurements when we're doing prosthetics and orthotics. The medial flare is this area right here. So this is a medial side of the leg. This area that kind of goes from a skinny portion and flares out into a bigger, flatter area here is called the medial flare. We use this in prosthetics. We also use it in orthotics if we're doing an unloading type of brace for the foot. So this medial flare is an area where we might push on to suspend the limb. So that's the medial flare. Then we have the head of the fibula. This is the fibula, of course, this lateral bone right here. And the head is this top little section right here, this kind of where it gets a little bit wider up in the top and sticks out some. If we look on the frontal view here on the lateral side, this would be the head of the fibula. This is an important one to know. We determine the height of AFOs off of this point. We come down usually 3/4 of an inch. And the reason we do that is because there's a nerve that runs right through here. And if that nerve is damaged, it can cause drop foot, so the patient can't raise their foot up in the air anymore. So we want to be careful of that. So we usually lower the trim line, the proximal trim line of your orthosis down below where that nerve might sit. So head of the fibula, another super important one. Medial tibial plateau, the top of the tibia up here is the plateau. So it's just a flat area where the condyles of the femur ride. So medial tibial plateau, so it would be right in this area here would be our medial tibial plateau. And we do measure that, especially when we're trying to find knee center. That's one of the measurements we're going to use, or I should say bony prominence is we're going to use to determine where knee center is. So this is a medial tibial plateau. And then finally, this is kind of an old term, but in prosthetics we still use this. Sometimes you'll find manufacturers still calling this section of the prosthesis the shank. So the shank is basically from here up to here. So this area right in here is the shank. It's kind of the shin almost. So sometimes in prosthetics you'll hear the term shank. That's where it's coming from. Then the femur, the medial and lateral femoral condyles on the distal end down here. So this is a posterior view here. This is the medial side, and this is the lateral side. If we had to draw a pelvis in, the pelvis would be up in this area here. The condyles are these two bony kind of projections down here on the bottom. They're, what makes the joint surface basically. On the anterior view here, this is the lateral and medial, you have your condyles also, so you can see the anterior view of the condyles. The next one is the adductor tubercle. This bony little outcropping here is your adductor tubercle, and that has your adductor muscles, the muscles that pull your leg in medially and attach up here to the pelvis, attached to your adductor tubercle here. And again, this one is important for finding the location of the knee center. So we're going to use the adductor tubercle and the medial tibial plateau to find the location of the knee joint axis later on when we start working with those. Next is the patella. The patella is a sesamoid bone. So this is that sesamoid bone that's sitting in the tendon here. And typically we can also use this one to find knee center too. If you divide this in half, that's pretty well where your knee center sits. It's a good rule of thumb. And then we have the shaft. Of course, the shaft of the femur is just this area here, from here to about here, and from here to about there on this one. So that's the shaft of the femur. We will use the shaft of the femur to determine the adduction angle of the femur a lot of times in prosthetics, so it's a good location to know. Then we have the greater trochanter. So this is the greater trochanter here. Just for curiosity's sake, this is the lesser trochanter over here, but typically we don't use this as a bony landmark because it's buried deep within the soft tissue. The trochanter, on the other hand, can be found pretty easily. It can be palpated very easily, and we use the trochanter as a way to find the axis or center of the hip joint. So this is an important bony landmark when you get up into the hip region and try to locate joints. And then finally, the head of the femur. The head of the femur is not something you can palpate, but I just thought it'd be good to know this. This is the actual ball of the femur that gives the femur its multi-axial abilities. So it can do flexion, extension, adduction, abduction, and it can also do internal and external rotation because of this ball joint. Then we have the pelvis. We're just going to talk about the landmarks that relate to lower extremity right now in the pelvis, and those are the ischial tuberosities. So down here on the bottom, we have the ischial tuberosity on each side. We use this for a length measurement to determine height of braces. So it's a really important one. These are the bones that when you go to a baseball game and you're sitting on a hard bleacher, these are the ones that get sore at the end of the evening. So this is your bones that you sit on, basically, your ischial tuberosities. The iliac crest is this crest of bone that kind of goes around like a half moon shape up here, and it goes on both sides. We use this to place belts and things like that for hip joints. We'll use this for a bony landmark for that. And then we have an anterior superior iliac spine. It's also called the ASIS, and some people like to even shorten that farther and call it the as-is. But it is this location right here at the end of the iliac spine. It's a little bump. You can feel them on yourself if you just kind of go down your sides, and you'll run into two little hard bony landmarks there. Those are your ASISs on each side. Those are the three you need to know for the pelvis. Those are all the bony landmarks that we need to know. Now we're going to talk about some of the soft tissue landmarks that really aren't bony landmarks. So the first one is a sulcus. And you can see on the plantar surface of the foot here, this is the lateral side, this is the medial side. So we have our arch over here and our heel back here. This is the sulcus, and sulcus just means groove. Then we have the ball of the foot. So the ball of the foot is this area right here. It's the metatarsal heads, and we use this area a lot for shoe fitting, but it's just good to know what the ball of the foot actually is, because there's a lot of common knowledge out there about what the ball of the foot is, but that's kind of incorrect. Then we have the transverse arch. We have our longitudinal arch that everybody knows through here, right? So here's our longitudinal arch down here, Here's our longitudinal arch here. But there's also a transverse arch that runs across here that we have to support sometimes. And it's a kind of a lesser known arch. But that's your transverse arch. So it goes across, it transverses the foot, and the longitudinal arch goes down the long axis of the foot. Then we have the breast of the heel. So this is our heel back here. The area just anterior to what you typically call your heel, right through here, is called the breast of the heel. And we use this area for measuring heel heights and things like that with shoes or build-ups that we're going to be doing. So that's the breast of the heel. And then finally the Achilles tendon, and this is just running up the posterior of the leg back here. So that's your Achilles tendon back here. Yeah. Again, just from the posterior, we have the Achilles tendon. So that's your Achilles tendon right there. Then we have this big, long sentence here almost, and it's the musculotendinous junction of the gastrocnemius and the Achilles tendon. So we got our Achilles tendon here, and then up here we have our gastroc. It's kind of these muscles that kind of stick out on the back of the leg. The plantar flexes your foot. But this junction between the Achilles tendon and the gastroc, the belly of the gastroc up here, the muscle, is a place where we terminate certain devices. And so if you terminate a device right here, it really shouldn't go any higher than that. So that's the musculotendinous junction of the gastrocnemius and Achilles tendon. And the braces we make there are called SCFOs, and SCFOs shouldn't really go any higher than that height right there. Then we have the popliteal space or area. This is the area in the back of the knee. So when you bend your knee, this area right here would be your popliteal space. There's a lot of vascular tissue like veins and arteries and nerves that run through this area back here. And so we use that popliteal term to describe this area right back here. The gluteal fold. So the gluteal fold is just what you think it would be. So it's the fold of the gluteus back here. You can see there's a little fold right in here. That's the gluteal fold. And then the perineum is just a name for the groin. So groin or the crotch is often referred to as the perineum.